Question number 7, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Is he confident that health professionals have the resources required to provide quality health outcomes for New Zealanders?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes. Those health professionals include an extra 6,000 doctors and nurses since 2008. Those resources include an extra $2.2 billion over 4 years announced in Budget 2016, and those outcomes include an extra 119,000 specialist appointments and 53 operations per year compared to 2008. Of course, there will always be a debate about what the right level of resourcing is, otherwise there wouldn't be anything for Mrs King to do in Parliament. However, I'm well acquainted with that member's gloomy and...
Point of order, Mr Speaker. Well, that's unnecessary, isn't it?
No, it's certainly not necessary. It's an answer that doesn't help the order of the House, but in itself, it's not unparliamentary. There are no rules I can deal with. I'll deal with it another way. Supplementary question? Supplementary question, Sue Moroney.
Thank you. Why have claims for patients being injured while receiving health care increased by 96% between 2008 and 2016?
The Honourable Dr Jonathan Coleman.
Well, of course, the member would know that that's a question for the Minister responsible for ACC, but actually it's not totally clear what the drivers of those increased claims are. There could be a range of factors at play. It could be increased claiming behaviour. It could be the increasing medico-legal climate in regards to litigation, and it could also be due to the increasing volumes of people being treated through our hospital, the growth in population, and of course the fact that we can do more and more complex procedures for patients. All that could be possible contributions to what you're talking about there.
Great.
Supplementary question, Sue Moroney.
Is it possible that his underfunding of health services by $1.7 billion is the real reason that treatment injury costs have risen by 230% since 2008?
The Honourable Dr Jonathan.
No, it's not possible, because what she's claiming actually is not the case. The member knows that $1.7 billion has not been cut from the budget. In actual fact, the budget's gone up by $4 billion. So, to make out that it's otherwise, you're dealing with your own imaginary world as regards the financing of health.
Order. Is this a point of order?
Oh, it's a supplementary question.
Supplementary question, Sue Moroney.
Well, is there a link then between more than 1,000 resident doctors reporting being so fatigued they were worried about that clinical mistakes had been made, and this massive increase in treatment injuries under his watch?
The Honourable Dr Jonathan Coleman.
No more so than there's a link between the record majorities that members enjoy in every seat that Sue Moroney stands in.
Order. That doesn't even attempt to address the question. Would the Minister now address the question?
Well, I said no.
Supplementary question. Order. The matters. Order. The public of New Zealand will judge the Minister's answer for themselves. Sue Moroney, supplementary question.
Thank you, Mr Speaker. To the Minister, well, is he concerned then that due to the increased number of mistakes being made in the overstretched, poorly resourced health services, that the ACC board believes the cost of treatment injuries will overtake the cost of work injuries as being the most costly by the year 2023 if his regime is not stopped?
Well,
the Honourable Dr Jonathan Coleman.
I point out that I am not the member for ACC, but I disagree with the central assertion that she's making.
Question.